I have to say how delighted I am to be here. When Allison first invited me, I said, April 22nd. Let's see now, my daughter is due to deliver on April 23rd. I'll do this. I'll say, if I can make it, I'll make it, but no promises. The good news is that she delivered on Sunday, came home yesterday, and mother and baby doing well. It's actually relevant to what we're going to talk about today. I was thinking about this on the flight up here because I was born a long time ago, after the Second World War, when my parents worried about mostly infectious diseases. So at the time of my birth, the concern that most parents had was polio. To some extent, it was also measles and rubella, which was a big issue, especially during pregnancy. But there were a whole number of acute infectious diseases that are the things that parents worried about through the 1950s. When my children were born in the very late 70s, I didn't worry so much about that. Most of those things, especially polio, were actually completely out of the national consciousness, and we worried. Actually, I was trying to think about what were we worried about back then. And unfortunately, I'd have to say we were probably worried more about ourselves as parents than we were about the kids and all the things that might befall them. But acute infectious diseases were not on the list. This weekend, it was interesting as we talked about what we worried about for this generation. Autism is clearly on the list. We think about it. We think about it a lot. And in the context of neurodevelopmental disorders broadly, which are so much more part of our consciousness and our concerns, we also think about other kinds of challenges, of everything from serious food allergies, which have affected some of my grandkids, to things that we may not be able to put our fingers on, but come somewhat later, especially ADHD and certain sorts of mental disorders that are a challenge. But neurodevelopmental disorders are really on most parents' and grandparents' minds in a way that they weren't when my kids were born, or certainly when I was born, not an issue for my parents. What I'd like to focus on is actually quickly to take you through what are the things that we do think about in terms of what we know about autism. And it bears saying very clearly that this is indeed a neurodevelopmental disorder. Neuro meaning brain, so it involves the brain, and developmental is an important issue because the brain is going through so many transitions in the first 3 years of life. And you get a sense of that from this image taken from a group at UNC that's looking at healthy brain development, just how much the brain changes between birth and age 5. So when we say it's a neurodevelopmental disorder, it's really two things to think about. One is, where is the problem? But for neurodevelopmental, we also think a lot about when is the problem. Neurodevelopmental, almost by definition, involves problems with a trajectory. And we always have to remember that something may happen early, but you don't see the impact of it until much later. It's like if a track is broken, you don't see the problem until the train gets there, and that could be, in this case, 2 or 3 years after the fact. Is there a way of actually identifying what that broken track or what that particular target might look like? Well, lots of discussions about this. The paper that came out about a year ago in the New England Journal of Medicine, based on post-mortem studies, a very small sample, suggested that there was a sort of scrambling of the layer cake of the brain's cortex. That is, that cells that should have been deep were superficial, cells that should have been superficial were deep. In the kids with autism, I think it was 10 out of 11 of them showed this, not in any of the controls. You get a picture of that from this image at the bottom. Not clear that this will replicate, not clear even what the role of this is in any of the symptoms. But it's the beginning of maybe getting a sense of what has gone wrong in the brain. What is very clear is that when we think about autism, and its neurodevelopmental trajectory, that much of what you see may not be so much a part of autism itself as much as a consequence of having a neurodevelopmental disorder. So at age 6, how much of what you're seeing was part of the autism as a core, and how much is the consequence of having this illness, often not clear because the onset is much earlier. What we can say is that children with autism and adults with autism have many other things. We focus on this as a brain disorder, but it obviously involves the immune system, the gut, and importantly, involves other kinds of brain problems, depression, ADHD, seizures, all of which need to be thought about because they get overlooked when it comes time for treatment. What else do we know? Well, we talk a lot about etiology or cause. Both genetics and environmental factors are clearly involved. You'll hear more about the genetics from Dr. State in just a few moments. Just to borrow this image that you see on the screen from his paper with Jeremy Wilsey, his postdoc, a really interesting story that the genes that we're concerned about are often the very genes that are involved in brain development. And they may have a role prenatally that's very different than what you see after birth. And so we do now need to be thinking about this differently than we think about the genomics of other disorders like heart disease or cancer, because we need to be thinking about how the genes play out with respect to brain development. Often we don't have the tissue we need to know that. We don't know enough about what brains or what genes are doing and their variations are doing as the brain develops. One thing we can say is that kids who have autism, and you'll hear more about this from Dr. State, have a much higher rate of what we call rare mutations. These are those mutations that occur in less than 1% of the population. We really are struggling with this. In a recent paper that came out where there were 2 kids in the family affected, 46% of the time they had different rare mutations. So to borrow from Tolstoy, who said that all happy families are alike and all unhappy families are unhappy in their own way, there is this odd sense that these mutations occur in a very selective way. Though we call them rare, when you add them up, they may account for a large part of autism, and yet, even in the same family, you may get different versions of this problem. What I think we do need to admit to at this point is that even though genetic and environmental factors are emerging, we don't know how often they're causal, and we still have a lot of work to do to understand what any of those factors that may be associated with the risk for autism, what they have to do with the actual mechanism of the disorder. What else do we know? Well, we know that prevalence has increased, and indeed it has, and you can see that from the CDC numbers on this slide, a 123% increase since the CDC project began in 2002. If you use the California developmental disability data, about a 13-fold increase since the early 1960s or so, 1970s, when they were collecting these data. So these are huge, huge increases across time. What's not clear is whether that is an increase in the number of children affected or the number of children who are now detected. And our best guess is that both things are true, that we are detecting autism better than we were in the past, that this ascertainment may account for some half, roughly, of this increase, but it probably doesn't explain the entire increase. And that is the piece that still remains quite a mystery. What is not mysterious is that the costs have increased and they're enormous. So the best estimates we have from the science of autism would be that for any individual family, we're looking at somewhere between $2.4 and $3.2 million in lifetime costs for having a child with autism. And this enormous economic burden that we have to think about as a society, how that will be borne. Finally, in terms of what we know, I think we can say with some confidence at this point that treatments do work, in contrast to where we are for Alzheimer's disease, to where we are now for ALS and for many other brain disorders. Here we do have interventions that work, but they don't work for everybody. And what makes it, I think, a real challenge for us is we don't yet know how to match treatments with problems. Too often, what a person, child or adult, receives in the way of treatment depends on which door they knock on, not on what they actually need. That has to be reversed. We have to develop a kind of precision medicine that allows us to match interventions to individual needs in a far more precise way. We don't actually know enough yet about how to do that. What do we need? Well, there's a long list here, and as Allison mentioned, the Interagency Autism Coordinating Committee has put together this annual strategic plan built around these 7 chapters, each of which was suggested by the members of the committee as areas that we need to be thinking about. And in every one of these cases, from when should I be concerned to actually developing the kinds of tools we need in terms of infrastructure and surveillance, we have major, major needs that need to be considered. The strategic plan lays that out, talks about how that would be done, and it suggests some of the high priorities that need to be addressed in the near term, both by public and private partners. And that's actually the last thing I want to share with you, is that as we think about the needs, we can really, I think, put them together as sort of three buckets, and I'll do that very quickly. Last year I was here, I talked about the 4 I's of autism: identity, illness, injury, and insight. This time we're going to talk about the 3 S's. We certainly need more science, particularly to create that depth of understanding about mechanisms. We need the biomarkers to be able to stratify this disorder, understand the subtypes, and we certainly need not only the use of the current interventions, but better interventions. Services, absolutely, and you'll hear more about this this afternoon. It's not just quantity, access, it's also quality, improving the quality of care and making sure the benefits are there. And finally, we need to put together the kind of public-private partnership that's going to be essential to get us the tools. We've done this in areas of cancer, in areas of rare diseases. It still needs to be done in a really effective way here for autism. My last slide is to tell you that most of all, and this is as they say in the military, bottom line up front, well, this is bottom line at the back, research is essential for us to make progress. Science really is the way that we'll make progress for both children and adults with autism. As we say at NIMH, research equals hope. Thank you very much.